need of the healthcare provider, it has become very amazing results. So even before this flood hit us, we had our ground preparation already made, and that is why we could go immediately to the flood hit areas. Of course, the scale of it is not that much. We still are in the pilot phase, and we have actually on the ground had very the interest from the government PPHI was very much there, and we collaborated in at the local level in different districts. So the districts adjoining Mirpur Khas and other areas where the local collaboration actually automatically took place. So this was very natural and organic, but as it has been said, a lot of preparation is required. It is also important to emphasize that this technology needs to be grounded and translated into giving you a public health dividend. And I think there is no strength matching the government strength in terms of the spread of the structure, the HR that is available, and models where they have been tested and some results are available in terms of the evidence that we have gathered, I think can be replicated. This is a lot of work has to be done. We are marching on. By the way, it's not only the flood affected area. As far as access is concerned, now we have with our partner Tech for Life have reached North Waziristan in the farthest area, where some of the specialty at the category of hospital that is closer to the RHC, there those specialties were added with the consultation and a different telediagnostic support that is available. I think a lot of work has to be done, but it has to be naturalized, contextualized in our local conditions, and that is acceptable to the community.
Thank you so much, Dr. Ihsanullah, and I would like to add to it that definitely we have received an overwhelming response, absolutely beyond our expectations, because when we started this pilot phase, we were not expecting this kind of a response. As the team from the hands, they always keep updating us, and there are patients coming in and they are making the best use of the telemedicine kits, and we are really delighted that our technology is helping them, and especially the flood hit communities, and connecting them with the specialists, doctors, phonologists, and everyone in the urban areas. And it's lovely to provide them with the facilities which they can't have in the remote areas, especially after the flooding and all. Thank you so much, Dr. Ihsanullah. It's great to have you as our partners. It's great partnership with Hands. Now we are going to move to Mr. Shakil Akhtar from the Indus Hospital. So, Mr. Shakil Akhtar, Indus has been a torchbearer in technology use in general, of course, but now Indus is also paving the way for the telemedicine. So, what is your vision for the growth of telemedicine in the public-private model?
Indus already had a very good vision. In fact, they already have a vision to develop almost more than 200 primary care centers throughout Pakistan. In 2 to 3 years, definitely. We are increasing our telehealth centers, we are increasing our boat, we are increasing our buses. And like I totally agree with Dr. that this COVID thing actually changed a lot of things. Especially I can see there are a lot of IT as well as the doctors are sitting, so I must say they have changed the dynamics of the entire world, medical science as well. Because initially the doctor was, I used to always say that the doctors are rather more of a damad kind of a thing. Because damad होता है ना, जिसको कुछ भी खिला दो उसका मुंह सीधा होता है. So doctors are always like that. So it is very tough for them to let them take on board and let them help to come onto the gadget side of it. But the COVID actually made the difference. Now the doctors are coming into our center asking them, they need the patient record and all that on the mobiles and all that. So as far as the technology is concerned, we are already using Tech for Life since a very long time, and very successfully they are running on that. So as far as your question is concerned, the public-private partnership, like I said earlier, We are actually working with the government of Sindh and Punjab and KPK and Balochistan already. So we have been discussing a lot of projects and plans in the rural areas, at the areas like Gilgit, Baltistan and all that. So we are already working on that. So inshallah we will be increasing our services with the grace of Allah.
Wonderful. Thank you, Mr. Shakil Akhtar, and we are always there as a technology partner whenever you need support. Thank you. So my next question is for Dr. Miraj Shah from the AKU. Dr. Shah, since AKU is also, not even need to mention, everyone knows that AKU is a hub for support and innovation. So, in the light of this event that we are having, with special focus on telemedicine and telehealth, so are you also planning to utilize and use telemedicine services in the remote locations to benefit from the technology and also capacity building in this field?
Once again, thank you. So, just to give the audience a perspective, you'll be surprised to know AKU started telemedicine in one form, in primitive form, in 2007. And we started this when we took over the management charge of one of the hospital in partnership with the government of Afghanistan and French NGO, the French Medical Institute for Children in Kabul, that still we are managing. So we started telemedicine at that time. Learning curve is going gradually up. And then when the pandemic hit, it became a necessity, it became a need. And like everyone sitting here in this room, we also learned a lot of things about telemedicine. Talking in terms of the real volumes, real numbers, our experience during the pandemic was, yes, it really helped people in creating a very safe access in those difficult times. But when you see the demographics and when you try to learn the needs and expectations of people, still we found many people would like to be seen physically, and that pattern is gradually changing. So you are absolutely right. AKU has a vision. AKU is moving towards the technology platforms. Our Center for Innovation of Medical Education, CIME, is one platform where we are doing many things in terms of the technology, not only for telehealth, but of course the application of technology in many aspects of healthcare, right? Remote monitoring, you name it. So as we move forward, yes, we will be in a situation where we will be helping out the communities that we are serving around us and providing some great learning opportunities, like the one recent example I gave you about the tele-ICU. I hope that answers your question.
For sure. Thank you so much, Dr. Miraj Shah. It was wonderful to know, especially about that 2007 starting of the telehealth services. So, okay, my next question is for Dr. Harun Khan from eHealth Association Pakistan. Since we are talking about capacity building, so Dr. Khan, of course, eHealth Association of Pakistan has always supported capacity building in Pakistan when it comes to telemedicine and digital health. So, what is your vision for both formal and informal programs when it comes to capacity building in Pakistan?
I'll give a short answer to that. What we are really interested in is providing, number one, the manpower so that this process can go on. When the need and the requirement increases, there should be people who are willing and ready to take over. So education is one of the steps that we are going to take. And second part is governance. The rules and regulation, they don't exist. And I'm so glad to know today that the government of Sindh is planning to do that. And I think a document should be prepared and should be ready, which can then be applied across the country. So if we get together, we sit together and prepare that document, I think it will help Pakistan when it comes to implementing these rules and regulations. So I'm very happy about that.
Wonderful. Thank you so much, Dr. Harun Khan. And I also absolutely agree that policy making, and this is something very important and crucial, and it's great that Sindh Healthcare Commission is already working on that. And I think one benefit of having all of you expert panelists here is that of course all of you are working for the disaster response and telehealth, but coming from different perspective and dimension, it really adds quality to what we can see the larger picture where everyone shares their thought and what they are doing, and collectively we can definitely make a change when it comes to revolutionizing and educating people on telehealth in general, because of course we are still transitioning. So I think now we have to quickly move on to the live Q&A session from the audience. So since we are speaking about the transitioning, so before we move to the audience, I have one question for the expert panelists. So I also want to benefit from all of you. So whoever would like to respond this, I have personally felt that, of course, Pakistan is a developing country, and still there is a long way to go when it comes to transitioning into digital trends and all. So if we talk about the health providers in general, how can we improve the willingness and preparedness of the health providers to use telehealth and digital services? Whoever would like to respond to it, please go ahead. Thanks. Yeah, thank you.
See, so there is a generation gap here. So there is this technology that came in. So there is a generation that has grown up with it. For them, I think it's quite natural and quite normal, and I think they will just readily adapt to it. And that is specifically why undergraduate curriculum should now just adopt it, because this is it. This is what we are doing. And then there is those who are seniors. उनको थोड़े से problems आते हैं, but with all these smartphones and these things, just a tiny bit of training, it really helps them. I have seen very senior people really using technology way better than I can, because they have taken some help, a little bit of help, and I think they can all get on to this thing very easily. There was going to be a very little percentage who may have this, this blockage and reluctance to adopt it. So that is fine, I think, I guess, at this stage in life, if they're adopting something, that's just the best. And if there's enough support system, some technician, somebody just supporting them, I think this is good. I have not seen people not wanting to do it.
And I think, Dr. Zainab, you are a policy maker, so you can definitely work on that in improving that. So wonderful. Thank you so much, Dr. Zainab. So quickly from the audience, if anyone, yes, Dr. Khanani. Assalamu alaikum, Dr. Khanani. It's lovely to have you here today. So I can come to you, no problem.
Assalamu alaikum. I am Professor Dr. V. Khanani, and I am also a friend of Sharik Khoja as well as Tech for Life. I applied for a telemedicine clinic to Sindh Healthcare Commission about 4 years ago, and I was told that why is it required? So that was the question. So I explained to them that how the things can required and how can we improve quality, so it's a mandatory requirement. Coming back to the questions that you asked, there is a need, because I am from the generation that you talked about. We are worn out generations, so we have to de-learn first and then we relearn what the new technology is. But fortunately some of us are very much willing to do it, and I have been in constant touch with Tech for Life. To improve the situation, we really need to train the coordinators that you are talking about. That we have started, I was in Canada, and they have started this training of coordinators, health coordinators, who used to help the physicians in learning how to manage those technology things. I'm glad that Sharik Khoja and Tech Force team is also training some of our people, doctors as well as coordinators for these trainings. So I understand that if these trainings are done, and as was mentioned by the Dr. Harun, that if we include it in our undergraduate curricula, as well as of course we organize the training for the doctors, it will be very helpful. The platform that has been developed by the TechCore is so easy and user-friendly that I don't think that it requires much effort for the doctors. Thank you.
Thank you so much, Dr. Khanani. I think we can better address the question. So
Can I respond to the Khanani, please?
But before you take a question, let me just add to the professor's comments.
Yeah.
I think this is such an important thing. We have a tendency to medicalize everything, and that's the cousin sister of telehealth. That you need to task shift things. the cadre that you have suggested, it is important and most significant part that they can play. And we have seen that technology has its own dynamics of teaching and learning. You know, what usually the conventional menu will take 18 months or 2 years, you can do it in 1 week or 2 weeks. You know? And that's we have learned while we were developing the capacity of our field workers and LHVs and all. And we have also recognized, and this has been acknowledged in the community, that with this empowerment of this cadre of LHV, they are recognized as new ambassadors and front runners of the health sectors. And perhaps doctors and clinicians especially would take it as their ground taken, but I think it's the tendency to medicalize everything should be resisted, especially when this large scale implementation or this large scale need is concerned. I still think that your question or the question of the government still is valid, because the resources are limited and it has to be positioned very carefully.
Thank you, Dr. Ihsanullah. We only have a couple of minutes left, so we can really take.
Can I respond, please?
Unfortunately, we are really running short on time. We only can take one more question. So, and if we can just. Sorry,
The minister has time is fine.
so that's fine. Okay, so I think yes, please go ahead, sir. So
Just
now.
for the record, the minister was supposed to go to Darkhana, but he's cancelled it because the corona case is so much.
Okay, thank you so much. So now we can take some more questions. Thank you.
This is not a question, but just sort of feedback on what has been discussed over here.
Sure.
I'm Dr. Minhaj Kazai, I'm founder and CEO of the Healthcare Commission.
Wonderful.
I just want to supplement what Jana said. And what Rick said, probably Dr. Pick never came to it because I helped Sehat Khani in developing their entire model. So that was something that helped them to develop. But as far as the telemedicine and telehealth is concerned, I think this is a growing field and we should acknowledge its presence and utility among the not only physicians but non-physicians and paramedics also at the same time. And what HANDS is doing with their market workers, I think that's very good. But the only thing is that we need to consider in the current situation that there's a lot of quackery going on the field. And when we have those people who are undertaking telemedicine, we need to make sure that their PMDC is valid and they are registered with the Central Healthcare Commission. So that's the 2 points I just want to make sure कि इस प्लेटफॉर्म से ये मैसेज जरूर जाए कि जो भी टेलीमेडिसिन में रिस्पॉन्सिबल है वो इसको काम कर रहा है. The doctor is registered, the clinic is registered,
Absolutely.
and
That's
all
important.
those people have their valid PMDCs. Thank you.
Thank you so much. Duly noted. Now we only have a couple of more minutes, so we have to take the question, no comments, please, because we have a very limited time. So if you have any question, please raise your hand. Yes.
Assalamu alaikum, Hassan Rabbani from Childlife Foundation. A question to any of the panelists. There are two broad segments of the telemedicine market. One is the provider-patient combination, and the other one is the provider-provider combination, which is considered the low-hanging fruit. Any comments how we can improve the quality and the referral part of the provider-provider network? Considering that we are working with about 100 government hospitals and we've seen some impact. But I'd like to get some experience from AKU or HANDS or anyone else on the provider-provider network.
Thank you, Dr. Esenpal. Again, I'll refer back to the recent example I just shared. When the pandemic hit, provider-provider platform was this tele-ICU, where our intensivists, anesthesiologists, and people fully credentialed and privileged for critical care, they were providing training to all the care providers involved in the critical care of the patient around the country. So that is a wonderful example, and that example can work in many other provider-to-provider interactions. So that is my simple response to that.
I hope Dr. Miraj has responded to your question. Thank you. All right, so moving on, next we have from the ladies section. So someone here, please go ahead.
Okay, thank you. My name is Azra Naseem. I'm from Al Khan University. I work in the digital learning space.
Welcome.
This is a very insightful conversation that took place. I believe that one of the opportunities that technology affords us is to work in the prevention space. So I'm wondering if the organizations that are represented here, have you sort of done any projects, or do you have any ongoing programs where you're using technology to educate particularly the younger population about good healthcare, sort of like enhancing their health literacy? I'm very interested in that because with the extensive use of technology, particularly amongst the younger group, there are lots of myths and misconceptions that they're picking up, going on YouTube and things like that. So I'm just wondering, is there anything happening in that space in Pakistan?
Sure. So who would like to respond to that?
अच्छा इसमें थोड़ा सा मैं आपको इसमें ऐड करूँ the answering the question. In fact, maybe it is basically having a lot of volunteers programs and internship programs with a lot of different universities and colleges and even the schools level. They are working with we are actually calling volunteers. They are coming up to us for 15 days, 20 days time. They spend more of a time with the patient, with the attendant, with the workers and all that. That is one part of it. The another part is basically to provide them education. We just let them understand what exactly how, even the CPR thing. They learn CPR, they learn first aid thing. Because there are so many things which is basically happening in the disorder. The other part is basically our education side. There are education institutions with, I'm sure you must have aware that Indus is already going to have a university as well. We got four colleges too. So those colleges and universities are actually establishing kind of a programs for the students. They are coming on to the YouTube, they are coming on our own channels. So we are already working on that.
Thank you so much, Mr. Shakil. Dr. Hassan.
That should be, what I understood on the prevention side. If you have seen the Mavi, and of course very similar to eligibility program and the field workers that are there from public sector and private sector. In the private sector, like other organizations working in the communities, HANDS also has established this Mavi worker program. And they are, if you see each Mavi, that is a village woman that is empowered and is given a gadget, a tablet, on which all the health promotion related to family planning, RMNCH related education and health promotion material. And it is in the local languages, so it has been developed with all the audio, visual and help that is possible. That has been going on for last now 7 years, and it started with Bill and Melinda Gates Foundation. The most important critical thing is that all these interventions are keeping the sustainability part of it. And that's why the Mavi Worker program, like other similar programs like CMW when it started with NPPI in 2010, there is an enterprise also that is supporting it. So the Mavi House is actually the enterprise. The success part as compared to the CMW started in NPPI was that 93% of these Mavi houses are now sustaining and diffusing after the funding has stopped. So it is continuing, it is there, and we always would invite and welcome if you can accompany us and see for yourself how it is executed.
Thank you, Dr. Ahsanullah. That was extremely insightful and helpful for the questioner as well, hopefully. So, ladies and gentlemen, unfortunately, due to limited time, we can't, of course, it's engaging and I'm thoroughly enjoying this Q&A session, but unfortunately, we can't continue this. Maybe some other seminar we are going to conduct and we will invite you once again. So for now, that's a wrap for this panel discussion. I would like to thank all our expert panelists who came here. Please give a huge round of applause for all of them. Thank you so much for coming in, and I thoroughly enjoyed myself, please. Thank you. Please take your seat. I would like to request Rubab to please take over once again.
Thank you, Essen. So it's back to me again.
I would like to say thank you to all the panelists who have shared their expert opinions, and not often do we see such information, such experts under one umbrella sitting and sharing their insights with us. And it's very difficult to put a time constraint on such information, and I can say that SN would have the most difficult time containing such experts' knowledge coming his way. But still, we do have certain guests who have taken time out of their busy schedules to be here. So moving forward, I think now it's long overdue that we now have to invite our CEO and founder Tech for Life Enterprises, Dr. Sharik Khorja, and may I add to it, not that he requires much introduction, but may I add the captain to the ship of Tech for Life Enterprises. Just a few words that I have to say for him. We can all vouch for that, and if I may take the liberty of speaking for all the people that are here, that we can all vouch for the efforts and the dedication that Dr. Sharik has put in Tech for Life Enterprises and to progress the company to where it is today. Dr. Sharik Khorja is an innovator, researcher, and entrepreneur in the use of technology for improving health. He leads both research and commercial operations of Tech for Life Enterprises, and his past experience includes work as advisor on evidence, capacity, and policy at the mHealth Alliance, United Nations Foundation, and director of the eHealth Resource Center for the Aga Khan Development Network in Nairobi, Kenya, and Karachi, Pakistan. Please put your hands together for Dr. Sharik Khorja.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. Thanks so much for being here, and thanks Rubab for the introduction. I think I thoroughly enjoyed the panel discussion, especially all the panelists who have been our partners in programs that we are implementing with them. I think it was wonderful to hear directly from them and get so many different information that I really did not know, especially about Waziristan. That was wonderful to know. Dr. Hassan about the implementation there as well. I especially thank, other than the panelists, our chief guest, Mr. Appel, Dr. Asra, people from the government, other private agencies, people from Pakistan Navy who are here, and all other partners who have taken out time and have been here today. I will not talk too much about other work that we are doing. I think that's all available on the website, on the web. I don't want to bore you guys, but since today we are all here to talk about how telemedicine and telehealth has worked in disasters, I'll focus on that and try to tell you some journey where telemedicine has contributed, and we have been part of some of these initiatives as well. Currently, by the grace of God, we are in 5 continents. That we are working in about 20 countries, and many of these programs in these countries that you see are related to disasters. Some of them are here, which I will highlight. But this journey starts long ago. I remember back in 2010 when the Attawabad disaster happened, and at that time, I have personal touch with that because I with my family were there in Gilgit, and we were planning to go to Sust and Gulmarg from Karimabad. And people who know that area know that you pass through this area of Attawabad where the disaster happened. And we were advised not to go to those areas. I was proudly part of AKU at that time. And I had the team with me who were going there to implement telemedicine. I said, no, we have to go. This is important. We are here for telemedicine and we will go. So I, with my family and with those team, Shabir is there, he was with me at that time. We went there, we implemented telemedicine in Sust and Gulmarg, came back while that specific activity was going on. We came back to Karimabad, and the next day, this disaster happened. And for months, the areas near China border in Gujarat area were totally cut off from the rest of the country. And the only way they were getting telemedicine was, they were getting healthcare was telemedicine. And our team, they were part of AKU at that time, joined Tech for Life later, and are still working in this field, were phenomenal in putting all this work together. But a lot of other efforts in terms of disaster are being done, and I'll give you some examples here that we are doing, starting from a recent work in South America, in Guyana, where we are working with the Ministry of Health, and we are putting health, you all know that in Caribbean islands, in Guyana, they are very prone to hurricanes almost all year, and they usually get huge disasters throughout the year. So the government wanted to establish health facilities, especially on the islands, connecting them to the mainland in Georgetown to provide health facilities, and we have started working with them. And a big part of it is air ambulances, that they are putting telemedicine kits into it, and Tech for Life's ambulance kits, which you may be able to see if you go at the back after the session is completed. We are putting those kits into their air ambulances, and hopefully those will be available for people in those islands at the time of disasters. Another example is Egypt, where it's more of a disaster preparedness that's going on, and we are working with Red Crescent there. They are taking the lead in putting telemedicine equipment all over the country and preparing health organizations for any types of disasters. We are working with multiple organizations in Egypt, and also this program has now spread to Morocco. And mainly what we are trying to do is prepare the health facilities, prepare the health providers in using these telemedicine equipment, and they are all ready and prepared whenever any such event happens. Similar work with the help of Health Partners International Canada and one of the Christian organization in Kenya. We started in slums of Kenya about 2 years ago, and the program has now spread around Nairobi and in Western Kenya as well, around Kisumu, where we are especially targeting areas which are slums like this, and where the health facilities are extremely difficult to reach on a regular basis. So here also, how to identify people who can lead local healthcare, train them, give them the kits, make them prepared for any events that may happen, and they are ready for giving telemedicine care in those areas. And this project is something that we really cherish. Coming close to home, the work that was put into Afghanistan is something that I would definitely talk about. As we all know about Afghanistan, we barely hit by all the situation that we have seen there over decades. And the program that was started about 6 years ago in Afghanistan, mainly in the area of mental health, through the funding that we got from Grand Challenges Canada programs, is still going on with Aga Khan Health Services and with the government, is one of the flagship programs that I mentioned. In this program, we actually gave the power of technologies to young adults. So our target population was these young adults, 15 to 24 years old, who have mobile phones in the community or can have access to mobile phones. There were applications made for them to improve their awareness, and they could access a lot of information, a lot of awareness about mental health directly from their phones and the information that was made available to them. At the same time, the community-based health workers were given applications on their mobile phones so that they can screen the people in the community, identify the ones who need healthcare and can refer them. At the same time, all the WHO guidelines for MHGAP, as we call it, they were put on their phones, and they can use those to triage the patients as well. And finally, teleconsultations was also an important component of this. A lot of community awareness was done through telemedicine technology as well, along with the consultations. We've already talked about programs that have happened in Khyber Pakhtunkhwa, and you can see here a number of districts. They already have healthcare, including in areas like Chitral, which are very disaster prone, and the health care facilities there are now connected with Peshawar, the telemedicine technologies. In fact, our first telemedicine kit, I should tell you, several years back was sold to the government in KP, and that's where the journey started, and we could see how these telemedicine kits can really make an impact. Similar work the team has recently done in other Jammu Kashmir as well, but where several centers to have telemedicine now. Many of these centers, as our teams were there and they were implementing, were very close to the border in very, very difficult areas. But this program is also a phenomenal program. It's already started working now, and people are benefiting from telemedicine technologies right in those areas. We highly cherish the work with HENS. In fact, these are some pictures from the response that we provided with HENS in medical camps to the flood affected people. As you can see, these gadgets were taken, the telemedicine kits, the vital sign ECGs, ultrasounds. They were all taken to different places all over the province, and the people benefited from these technologies as well, along with the great work that HENS is doing in many places. And this was a formal MOU signing with HENS, the partnership that we really cherish. So as Tech for Life, we really believe this is just the beginning. We definitely have made a lot of technologies over the past 9 to 10 years, and we want to just keep growing. And we do this because we strongly believe that the opportunity is limitless, and that's why the innovations we make should also be limitless. There should be no barriers. Whatever we make with the concept that they should be used anywhere that they are needed, in whatever conditions. And we do get partners, clients who come and say, we want to use it in areas where there is absolutely no bandwidth, no connectivity at all, and we make sure that they can use our solutions even in those areas, or where there is absolutely no access at all, and things can be used in those areas. At the same time, we believe in limitless partnerships. We can't do everything alone. We are still a small team. Still here about 20, but I think the work that the team is doing is for more than 200 people, and it's only possible because of the great partners that we have all along, not just in Pakistan, abroad as well, governments, private organizations, and we really cherish what we have achieved. All the awards being among the top 25 up-and-coming technology companies in Canada that we got awarded by Branham 300, and the most innovative telemedicine solution design company by GHP in 2020 as well. So with all these partnerships and our teams who are working on innovations, we have been able to achieve a lot of great things, the technology, telemedicine solutions, which is absolutely nothing that's new. There are so many technology solutions available, but when we talk to people, unfortunately in Pakistan, people still ask, how is it different from WhatsApp? How is it different from Skype or any other solution? But I've read that in many places now, awareness has increased and people understand that telemedicine solution is not just something that you need for two-way communication. There are so many other things that are attached to it, and especially the work that we have done to make sure that data is protected, all the information that's there is protected, and we have HIPAA compliance. How easy it should be to integrate with other softwares, other hardware, and it should be just plug and play. When you attach a device with a telemedicine solution, your healthcare provider in the community is not a technology expert. You do not have to train them for weeks to use the technology. It has to be plug and play, and that's how we try and make our solutions by making them HL 7 compliant. Making sure that the images that you get through the telemedicine solutions are of diagnostic quality, and that's why they have to be DICOM compatible. And you should have full integration with electronic medical record systems, etc. And you have to provide end-to-end telemedicine solutions, right from the patient to the consultant. Very rightly mentioned by our audience that there are provider to provider and patient to provider models, and it has to cover everything that we have. So our teams keep working in all those areas, making sure that the solution is available. At the same time, it works on all kinds of bandwidth, even if we take it into disaster areas where we have very limited bandwidth, the solutions should work. At the same time, we are working on many devices. Our digital stethoscopes, a lot of people have used, they know. We are moving into new models of digital stethoscope that you can also see there, which can very easily be connected to Bluetooth to a number of devices. And we are moving into artificial intelligence. Madam Minister talked about that a little while ago when we were having a round of those solutions there in that room. And she mentioned how important it is for the health providers to get help from the technology itself to make the diagnosis and easily pick the patients who need more help, and that's what we are going to do. A lot of cameras that are needed by providers in rural areas, and that's what we are trying to provide. But the best technology that we are, I think, working on right now, and we continue to work, we will continue to work, is our telemedicine kits. Our roots in SIM have given this the name Sojro, and we cherish that as well. So yeah, all different kinds of kits, whoever needs it, whether it's required for home care, whether it's required by primary healthcare providers, all different kinds of kits have to be there. And recently we have gone into more types of kits, like specialized home kits for nurses and other people who visit homes regularly for providing care to patients. Ambulance-based kits, which are now being used in ambulances on the roads and in the air, disaster and military kits. And there are special features to these kits which you can see and ask the people who are there with these kits at the back why these kits are specialized in those specific areas. And we have worked a lot mainly on the type of bags, the kits that you are required, the equipment that is needed in those specific situations, the power supply that you need, the connectivity that you need, and all that is extremely critical when you are using telemedicine in different areas. And the telemedicine trolleys is also something that we have recently implemented. I'll just quickly go and show you a quick video before we move ahead.
Telemedicine kits are designed with keeping price and mobility. telemedicine kits are designed with keeping price and mobility in mind. These revolutionary kits contain multiple devices that can be used in areas with limited infrastructure and mobility. Turn the ambulances into hospitals by offering specialized care while transporting patients. With the rugged and compact carrying case, several telemedicine kits easily fit in the ambulance and resist jerks. It features easy charging through the vehicle's power supply and backup power for long distances. Multiple network options for easy connectivity, monitoring devices for transferring real-time, storing and forwarding data and images. Plug Your Home brings healthcare and diagnostics to your home and office. Turn your home into a specialized medical clinic using the highly affordable and simple to use telemedicine kit that includes devices for monitoring a variety of communicable and chronic conditions. Featuring a compact design for quick and effective consultation and easy storage. Multiple connectivity options for seamless interaction and easy to connect for sending live or store and forward data. Make a specialist reach your patients in the emergency room, intensive care, and ward by taking the well-equipped telemedicine card to your patient's bedside. Our advanced telemedicine trolley contains touchscreen monitors, monitoring devices, and backup power supply. Easy to move in hospital settings for placement near patient bedsides in the ER, ICU, wards, and clinics. Adjustable height for cameras, screens, and monitoring devices. Improve your preparedness and management of health services in times of a disaster or military combat. The specialized telemedicine kits reach the most vulnerable population immediately to prevent and respond to high-risk situations. Highly rugged telemedicine bag to face tough situations in most disasters. Resistant to heat, fire, and water to provide telemedicine experience in most situations. Easy charging through alternative power sources and backup power for long duration. Tech for Life Enterprises stands for making healthcare accessible to everyone. We empower healthcare workers by using high quality, simple, and affordable solutions. We understand the needs of different users and design, so we implement a full range of integrated telemedicine solutions, both hardware and software. Visit techforlifeenterprises.com for more information or to get in touch with one of our professionals.
Thank you. And I'll just move to one more video. And this is one of the new technologies that we have worked on, especially for the areas where, as we work in different countries, we find that there are a number of areas where the reach is extremely difficult. We have been working as a side project on this new technology, which we feel is now ready, and we should be able to launch very soon. So we are to show you our new solution, which is soldier drones that we are implementing. And let's have a look. So these are telemedicine drones that we are using now for telemedicine purposes, of course, which are able to carry weights to long distances, and they are equipped with telemedicine technologies. We are using their cameras, their GPS technology, so you can basically program it and send it to wherever you need to send the drones. And it has all the telemedicine equipment that are needed for providing care in the distant areas. Especially if you know what is the specific need, you can equip it with those specific devices, and these can reach those areas. Right now, it has 5 kilometers reach and can go for 30 minutes. But this is just the beginning. Definitely won't start here. These were the first tests that we did. But the video that you saw were done in actual rural conditions, and we could really send it to 5 kilometers. But here, hopefully, we will try to increase the range and the time that it can fly for. So, great work, team. Okay, so I'll quickly go to a couple of other technologies which you will also be able to see when you go back, especially our non-invasive hemoglobin monitor. I thank a lot of partners who have helped us with this in Pakistan and abroad. In Pakistan, we got help initially from Dr. Hananian's team at Dow University and City Labs, and now recently with TBI as well, who helped us with testing of smart hemoglobin monitors, non-invasive hemoglobin monitoring, and a lot of partners in other countries. Especially we have done the trials in India, in Kenya, and all those have told that these non-invasive hemoglobin monitors are highly effective. With those trials getting completed, we are now ready to launch. I know Madam Minister, she always keeps asking about this when we are launching that, and inshallah very soon. We have the prototypes ready, which you can also see when you visit the room, but we are now getting this new prototype in this shape ready, and hopefully very soon we'll have the final product in the market as well. Something that we are working for still is a maternal wristband, which will also be soon. I think after the hemoglobin monitor, we have to work on that. The wristband that women in remotest parts of the world can wear, and it monitors their hemoglobin, glucose, blood pressure on a regular basis, sends all data to the doctors and to the health system, where they can easily triage the women who need further care and bring them to the hospitals. And we have named that GDL. Hopefully that will be out for people as well. So that's it, and I really thank all our team members who have done great effort in bringing us here. At the same time, all the partners again who have helped the teams, our teams in Pakistan and abroad, everywhere, to get to where we are and continuing this journey as we go along. Thank you so much.
Thank you, Dr. Sharik, for taking us through the entire journey of Tech for Life. And may I add that this presentation was not only the work that Tech for Life has done, it is the whole 10-year journey, the whole struggle and the hard work that has gone in. And Dr. Sharik must be very pleasantly happy that now, even after all these years, now we are seeing acceptance and awareness with respect to telemedicine and telemedicine solutions, which Tech for Life has been doing for years. On that note, I now would like to introduce and would like to welcome our Minister Health and Population Welfare Sindh, Dr. Azra Petro. Not that she requires any introduction, but I must say a few words in her honor. She has an excellent portfolio when it comes to health and population welfare. during her leadership and in her tenure and it's just a recent stats that over 8 lakh flood affectees were successfully treated in free health camps, which in itself is a very commendable effort. So please give a warm welcome to our Minister, Dr. Azra.
Thank you very much. Sharik has been in communication for a very long time, and I think we're still struggling with, because of the red tapeism within the government, to get the telemedicine equipment and things online with the vision that we're going forward with. The telehealth telemedicine legislation, जिसमें मैं थोड़ी सी बात कर दूँ. The telehealth telemedicine जो legislation की है, उसमें we have put in the caveat that every person, and I think Dr. Kedwai was talking about it, that they should be certified doctors. The organization that is doing, उसमें telemedicine जो legislation है, उसमें ये है कि certified doctor को उनकी जो telemedicine की services हैं, वो भी healthcare commission के साथ registered हैं. So that is what we have already taken care of in the legislation. There are two parts to the legislation. One is telehealth and one is telemedicine. Telemedicine has provider-client services and provider services that is part of the telemedicine. Telehealth services जो हैं वो provider and community है. This is what you asked for, where you asked what is the kind of provisions that you're putting in place for educating the population, general population. And communities हमारी बहुत unaware हैं, and the communities themselves do not have a good handle on what hygiene and health is all about. So really speaking, we've already obviously we have this legislation to go, so that the provider who is giving the information gives correct information, and the information is absolutely sound and does not have any biases within it, and is not misinformation within it. So वो telehealth का जो एक part है, we already starting it with we've got a World Bank money coming in for a program that we are starting in the government dispensaries, जिसमें हम community centers बना रहे हैं with attached to the government dispensaries, where women and children and adolescent girls and even men will come in and they will get telehealth sessions. And हमने ये भी देखा था कि when the floods happened, we already had our daily health workers giving telehealth talks and they were talking about telehealth, and they were not through telehealth, but they were giving talks on how health and hygiene. So वो थोड़ा सा already trained हैं the daily health workers in addressing the issues of health and addressing the issues of hygiene. So they were doing all sorts of personal hygiene lectures. They were giving lectures on menstrual hygiene. They were giving hygiene kits. We were giving out hygiene kits during these floods because we had, and also pregnancy-related information. So बहुत सारी चीजें during the floods हम कर रहे थे, but not through telehealth, and that is what was missing element जो हमने शुरू करना है. We did have a helpline where doctors were sitting in one of our units, and they were giving assistance and information on health to people who are calling in through the helpline. This also happened in COVID. We also have the same situation when the flood hit us. So we really have to work around telehealth and telemedicine, and I think Sharik's innovative kits are very, very essential and crucial. And one of the, I was quite pleasantly surprised to see the drone, because what happened during COVID was services were closed down. And obviously there were a lot of HIV patients and hepatitis C patients who needed medicines, and the chronically ill diabetic patients were registered with us and who needed their medicines. And this medicine was, obviously we tried to send it through mobile units, but I think one of the application of this drone would be that we send out medicines to these patients when we cannot reach them physically, or they cannot physically come to us for availing themselves of those medicines. So one of the good aspects of this drone would be one, usage would be of this. Yes, your ambulance kits, we have already spoken, and I want to put those ambulance kits into our ambulances also. We already have, we are in talks about that. And अभी हमने एक disaster mitigation plan बनाया है for any unforeseen disasters as was spoken here. That we are not prepared and we have a knee-jerk situation हो जाता है हमारे लिए when disasters hit us, and then we are running all over the place like headless chicken trying to solve the situation. And हमने ये देखा था during these floods. In COVID also we were not prepared, but in COVID as soon as it struck us, because we had such a huge vast experience from all the information that had come from all over the world, because we were a few last countries to get COVID, and there already was so much information around that we were able to address that quickly, and we were able to move quickly into that situation, though we were not prepared for it. We were up and about at our ICUs, our high dependency units, everything was done almost overnight. Week 10 days we were established, and we had our hospitals running and doing the work. Unfortunately for the flood, we were not prepared at all. The scale of the disaster was enormous, and the scale of disaster was more in rural areas than in the urban areas. So, हमारे लिए ये जो है accessibility was a huge problem, and obviously as you heard, communications were cut off. Even our telephone communications were cut off. We couldn't get through in mobile. And the earthquake में भी यही हुआ था. You know, it was like 48 hours before people knew that the earthquake had happened in KP and in Azad Jammu Kashmir. They didn't know about it. And it was practically 48 hours before people who had walked from those areas and come to the settled areas to tell them about the earthquake happening, and people then came to know about the earthquake. So similarly, हमारे यहाँ problem ये था, bridges down, water on the roads. It took us 12 hours to reach up to Larkana from Karachi. You know, it takes about 6 hours or 7 hours to reach there, but 12 to 14 hours लग रहे थे, और उससे ज़्यादा to get there. So really speaking, we have to have a disaster mitigation plan in place. So for that, we are already in process of planning. We have the funding, we are getting the funding for it. And हमारा disaster mitigation plan में obviously field hospitals हैं, mobile units हैं, and also ये telehealth and telemedicine services हैं, जो will go a long way in helping us to understand, be able to respond to the situation. So ये चीजें जो हैं, we have to move to the modern world. Unfortunately, we are still living in a stone age in some places. And the other opportunity with this telemedicine, telehealth services is the paucity of HR. HR is a great problem. Trained, specialized HR is not available everywhere in our province. I'm speaking from Sindh's perspective. In our rural areas, we don't have specialized doctors. Or इसलिए COVID में, I think Alkhan was a helping hand when they started working with us on ICU personnel training, and it was a great help because immediately our people were able to handle COVID in our rural hospitals where they had never had the experience of doing intensive care. So ये इस तरह से, and specialized intensive care, because COVID was not the normal, usual intensive care services. It was specialized intensive care services. In fact, we didn't know which medicines to use. You must have been aware that chloroquine बहुत use हो रहा था एक ज़माने में, when it was finally it was debunked that it doesn't work. So really speaking, we had a lot of learning experience, and the learning curve was very steep, I think, for COVID. But unfortunately for this disaster, the flood disaster, because the scale was so huge and enormous, and it was, and I mean the accessibility problem, the fact that we didn't have enough HR, we had to immediately move to hiring new HR to help us in those specific areas to cope with the situation. We were very fortunate in that we have a very strong private-public partnership, and that really assisted us with all the institutions coming forward. And I also like to thank other provinces, because Punjab sent us teams, KP sent us teams from their universities to help us during this disaster. So I think when we all come together, I think Pakistan is a very resolute kind of country, and it has a resilience to handle a lot of difficulties, and the resilience also helps us to move forward. So हमने कोविड में resilience देखा, हमने ये flood में भी resilience देखा within the communities, and the way they have responded is really, really remarkable. The other thing that I want to really remark on is the mental health aspect, and the telehealth usage for mental health, telemedicine usage for mental health. We are already looking at this. In fact, we're going to have a center in Jinnah, in JPMC. We are setting up a center for tele-mental health, and this will help us to get engaged with communities and to engage with doctors. We're also doing a pilot project in 2 districts, Dadu and Kambar, because I think we have they are the most severely affected, where mental health conditions are unfortunately mental health diseases are concerned, where these 2 places are very, very vulnerable. So we are looking to doing a pilot project there with the community, and the community accessibility, the community services, training of clinical psychologists, and at the same time psychiatric assistance we are making a project, so we hopefully will get that done also soon, and it will be up and running. But with Sharik's project, we wanted to do a hub and spoke kind of project, where the hub was where the central doctors were, and a paramedic could also take this back and go into the field and go into various areas and do the assessment and send the information back to the hub, and the spokes would then be able to get the information of how to handle the patient. So because of paucity of doctors, and the doctors don't want to go to those remote areas, those rural areas, services where obviously social life is not as robust as in cities and towns. So really speaking, this will be of great help. So again, I'd like to say thank you to Sharik, and I wish him all success. And I think it's a great initiative, and I'm so proud that a Pakistani has moved forward in this initiative. Thank you. Pakistani Zindabad.
Thank you so much, Honorable Minister. Firstly, I would say for your presence, and also about telling us about the on-field challenges and the on-field challenges that are being posed in the implementation. But also we highly appreciate that the government is now shaking hands with innovators like us to have more advanced solutions rather than the conventional ones. We would now be commencing our session of souvenir distribution, but firstly, for all the above reasons mentioned and for the Minister to accept our invitation as being our chief guest, we would like to present a token of appreciation, and for that I would like to invite President E-Health Association of Pakistan, Dr. Harun Rida Khan, to present a souvenir to Minister. Round of applause, everyone, please. So now we'll be requesting the Minister to present souvenirs to our key partners and panelists. So first of all, we would like to invite Senator and Chairman Sindh Mental Health Authority, Dr. Kareem Khwaja, to please come up on stage. And since he's not made it, we acknowledge all of his efforts, and we'll be moving forward. Now I would move forward to our key panelists who have actually earlier made this event very engaging. Firstly, I would like to invite on stage Dr. Zainab Hassan to please come up on stage and receive the souvenir. Now second is our most engaged panelist, Dr. Ehsanullah Khan. Mr. Shakil Akhtar, please. A little enthusiasm from the audience there, please. No clapping. Dr. Mirajuddin Shah. Now we'll be inviting Dr. Harun Reza Khan again. Key partners for Tech for Life have always been an integral part, and we now move forward to recognizing our key partners who have played a vital role in the journey of Tech for Life. I would like to invite Technical Director, Trust for Vaccines and Immunization and Consultant Pediatrician, Dr. Zamir Hussain Sohab. Dr. Zamir Hussain has extended support in our trials and has been very efficiently involved with Tech for Life. Thank you, Dr. Zamir. May I now invite CEO Karachi Medical Complex, Dr. Rafiq Khanani, for his support in trials and also capacity building programs. We now have Project Manager Government of AJK Azad Jammu and Kashmir for his support and implementation of telemedicine solution in over 13 centers in AJK, Mr. Ehsan Sardar. Okay, since we don't have Mr. Ubaid Hussain also, who is the Project Manager of Health Department, Government of Khyber Pakhtunkhwa. He has been very efficient and very cooperative for the province-wide implementation of telemedicine, which spanned over 6 districts. I think we can clap in his absence too. Next we have from Faculty School of Nursing and Midwifery, Aga Khan University Hospital, Dr. Salima Gulzar, for her collaboration of school health programs and community awareness in the suburbs of Karachi. Next we have Project Manager from HANDS for the collaborative telemedicine responses in several districts of Karachi, Dr. Mariam Fatma. I think she has gone for prayers, we can always give it to the next.
So on behalf
of Mariam, Dr. Mariam. From Pakistan Navy we have Commodore Ashfaq Akhtar. A huge round of applause for him for his extensive support in our trials and our demonstration in Pakistan Navy. Thank you to all the presenters and also Minister Health. With the completion of this souvenir distribution, we actually now have a little surprise here, and that surprise is not even known to Dr. Sharik. I can see the physical look on his face, and Dr. Sharik has been very strictly instructive that we have to stick to the schedule, but we somehow have found a way to adjust this after his final review. So to wrap this up very quickly, so that the expressions of happiness don't change into a hint of anger quickly, I'll be moving towards the big reveal, but I'll not be doing that for myself on my own. I'll be inviting my colleagues, Mr. Ehsan Abbas and Samreen Fatma, to join me up here.
Assalamu alaikum everyone once again. So actually this is a surprise, as Bob has also mentioned. Even Dr. Sharik Khoja, our CEO, is not aware of it. So yes, I think now you can hear me better. So this is a surprise that we have kept from even Dr. Sharik Khoja, our CEO. So first of all, I would like to request Mr. Shabbir Hussain to please join us on stage. So Mr. Shabbir Hussain, our Director IT, and also Samreen Fatma, our Marketing Manager. So I'm speaking on behalf of Tech for Life Enterprises. We have, of course, presented the Shield of Honor to everyone who is here, our honorable esteemed guests, panelists, and partners. But now is the time to recognize and acknowledge the excellence and brilliance of the brains behind this technology, innovation, advancement, and this mega show today. So, ladies and gentlemen, we, the Tech for Life employees, we have decided that we are going to present Shield of Honor on behalf of entire Tech for Life Enterprises team to Dr. Sharik Khoja. Please give him a huge round of applause. Dr. Sharik Khoja, please come on stage. And I would request Samreen Fatma to do the honors. Samreen Fatma will do the honors, and Dr. Sharik Khoja, well deserved. Thank you so much, Dr. Sharik. So I would like to request Rabab to come back again and continue. Thank you.
So now we are towards the end of this whole event. For the final address, I would like to call upon stage for the vote of thanks. I'd like to call upon stage Director IT Operations and Projects at Tech for Life Enterprises. Please put your hands together for Shabbir Hussain.
Hello, good evening, everyone. First of all, I would like to thank you, all of you, taking your time, precious time out, your busy schedule, and gracing us our occasion with your presence. I would like to especially extend my appreciation and gratitude to our chief guest, Dr. Azra, and other panelists, guests, and special thanks to our media for covering our event. I have been associated with Tech for Life Enterprises for over 6 years now, and I am extremely pleased and delighted to see Tech for Life Enterprises where it is today. The presence of our honorable guest and chief guest today is an acknowledgement of our accomplishments and throughout 10 years journey. With all being said, I would like to thank you all once again, on behalf of entire team and Tech for Life Enterprises. Thank you so much.
Thank you, Mr. Shabbir Hussain. And as you know that we are almost to the end of our event here, and I'll be inviting all of you for the demonstrations and for the high tea also that is being arranged for all the guests. So that's it for the event. I'll be signing off as your host for the day, but I'll be joining you on the demonstration table as a demonstrator of our technology. Thank you so much, everyone.